Okay, here we go. We'll start the recording from here. My name is Steve Falk, and welcome to the Vaccine Awareness Using Direct Mail webinar. In less than a half an hour, we'll go through a whole bunch of detail about why this is a useful tool in your campaigns to raise awareness about vaccine clinics and public health. Going to be a great way to target this information into homes and apartments in locations that are close to the areas you're trying to do your communications to. My name is Steve Falk, and we're going to rip through things. I'm a fast talker, and I've got a nice selection of slides. I'm going to just test how the slides are working here. Let's make sure we can change them okay. There we go. I'm the president of Prime Data, and I'm also a Canada Post expert partner. We're a company that produces and executes direct mail campaigns, helping our customers do marketing and selling and do a lot of fundraising for hospitals and nonprofits as well. But we've been using direct mail for many years to be part of a multi-channel marketing experience. A little background on myself. I've been mailing since I was just a kid. If you remember Scholastic books, coming to schools. I started at 14 years of age working in the warehouse at a Scholastic book warehouse. So my dad worked for them, and I was putting labels on things, and for some reason I never got out of the labeling and mailing business, and I've used data and print and those channels to build my career around, and so I've done a lot of printed mail. Currently Prime Data does data and analytics and analysis and design to help make successful campaigns. I'm also involved in a fair amount of community service, and that's one of the reasons why I'm speaking on behalf of the Raising Community Awareness using direct mail, because over the years I've done quite a bit of service to the community, being on not-for-profit boards, starting a nonprofit. Last year I was actually recognized by the town of Aurora for my community leadership, and for that reason I feel like combining my experience with direct mail and my experience for community advocacy, it made a natural fit for me to speak a little bit about how you could use these two things together. And also the fact that I had been a speaker for the Stephen Lewis Foundation for a number of years. I spoke to over 100 groups about the pandemic, not the COVID pandemic, but the AIDS pandemic in Africa. And so I have also got a unique perspective on how pandemic communications work. Anyway, I understand some of the dilemmas and challenges you have as healthcare professionals trying to deliver information to communities, and I hope this short webinar will give you some keys on how to use and integrate direct mail. I'm going to try and keep it down to 20 or 30 minutes maximum, and here's the things you're going to take away. When is it best to use direct mail to get the most impact? And why is mail delivering great value for marketing communications? And what are some of the objections people have with it these days, and how to deal with those? Where you can target direct mail, how Canada Post makes it easy to get mail into local community areas, what are some of direct mail's best practices and some samples you're going to see, and then some of the costs and expected results that you get from this kind of thing. So here we go, we're going to rip on through it. I've got Beth joining me here who will watch for questions, and she may interrupt during the presentation. If you just put your hand up or hit the chat button in the corner there, you'll be able to join in. Thanks, Beth. I just wanted to start off here by showing people, in case they didn't know what I'm talking about as far as just postcards in the mail and the kinds of communications that people are successfully using. Already in healthcare, for things like the healthcare of your dog, for dentistry, for eye care, there is plenty of communications done with mail. They find that mixed in with SMS messages and people reminding you to come to your appointments with phone and email, that reminder postcards just deliver the goods. And you know, it's a more expensive method of reaching out to engage your customers, but it definitely delivers when it's an important message you're trying to relate of high value. So everyone from auto industry to your famous, Swiss Chalet, which I was at Swiss Chalet a couple of months ago, and it was 2 days after the flyer was out, and every single person standing in line up outside the Swiss Chalet, because at that time, COVID lockdowns, we had to wait outside, had a coupon in their hand. These things work. Mail still, I'm showing you these examples just to remind you that this is part of the 7 billion pieces of mail that Canada Post delivers every year in Canada. direct mail still is a very viable channel for communicating messages, and organizations don't take it lightly, and 7 billion pieces of it kind of speak for themselves. I also, looking around through and researching for this, I found that there were some academic studies that had done some work on the use of postcards and healthcare communications, specifically related to vaccines. In this case, if you want to look up the effective postcard reminders on flu vaccinations, you can find this statement, which says, "We find that postcard positively affected the average number of vaccines received by study participants." This was published by Cambridge University Press in July of 2020. It related to some work that was done a year or two before the COVID thing hit us about trying to get higher participation in flu vaccines, and found that postcards did have an impact. I also found another study about HPV vaccinations where they were trying to make sure or improve the rate of participation in HPV vaccinations, and they were mailing directly into homes, and postcard reminders increased participation and initiation by 60%. So you can find academic work that is related to healthcare. If you do a little bit of work on it, I know a ton of anecdotal work that speaks to the fact that this is a very viable channel for reaching into people's homes and getting messages into their hands. When does direct mail deliver great impact, and why is it used in certain situations and not? So in this little slide, we'll quickly talk about it. When the audience is local, neighborhood mail, the kind of mail that I'll be talking about mostly today, really works well. Something about the way the message is delivered, when it's not a national thing, it's something local. It feels right when you pick it in your mailbox and hold it in your hand, and you're saying, "Oh, there's a local thing going on." It resonates. It's easy to target locally. It's effective and cost effective for reaching small groups of people like that. And so when you want to get into the homes and hands of your audience and talk about local things, and you feel like getting it in their hands because it's physical and now they can touch it, if that's important, then yes, high value campaigns into people's homes locally, and also the fact that it fits in to a set of strategies and tactics that are involve all the other channels. So if you've used TV, radio, newspapers, you've done social media, maybe bought online ads, and all of your marketing channels have been kind of maximized, the next step might be to integrate direct mail. And I think oftentimes right now, with the current situation, with years of COVID activation on a bunch of other channels, that we may very well be at the tipping point where direct mail is the right thing to do. It's not the cheapest way to get out, but if you've already maximized those other channels and you're looking still for that extra lift, then that's where you get it. You have a high value message, the other channels have been used up, and you want one more trusted delivery channel. This seems like the right time for that. Why does mail deliver great marketing value? It turns out that the real trick, and the reason why mail performs, they've done some research on, is it gets right into your home. Your people are touching. It's a physical thing, and they've done research on the different impact that seeing a message that you touch. I mean, we've also read studies like you remember things more if you read it in a book versus read it on a screen. Your attention is longer. It activates more parts of your brain when you touch something physical. So it just sits longer and has a greater impact. Mail often sits around. Once somebody shows a little interest in it, brings it in the house, it can sit around on average. Canada did some studies recently, like 17 days. So as compared to a tweet where somebody just sweeps left and sees a quick media thing, and you think, hey, that got a view. It's milliseconds that it stays, whereas a piece of mail will sit around the house. And often when it's sitting around, it's on the fridge, or sitting on a counter or a coffee table, and other people in the house are seeing it as well. So your one hit into the house can often have a number of set of eyes on it. And it also is now a conduit, connecting itself to the digital world. So you've got your cell phone over here, and you got your mail piece here, and nearly everybody who has a serious engagement with your mail piece is going to be taking the cell phone, scanning the QR code, going to a website, checking out a statistic you've got, hand typing in maybe a website, there's a bunch of ways that you can take people from a postcard onto the internet now, either on a mobile phone or on their screens typing, that will allow them to get further information, and ideally to engage with something where you can now push notifications to them. So if the landing page is where they go to, say things like sign up for our regular email newsletter, or would you like to be notified when a clinic opens near you, then now you have the opportunity to gather some email addresses. I don't know how sophisticated your systems are behind in healthcare, but if you can gather an email address, say on a sign up form for MailChimp, then when the time comes and a clinic's opening in the area, you can push a notification email out to everybody and give them more up-to-date information over the coming weeks and months as clinics open up and information changes. It's a trusted channel, and I'll come to that in a minute, why it is. Canada Post has experienced a surge in not only demand, but also trust. The Gustafson Brand Trust Index has shown that it's grown significantly, as you can see by this line here, especially because people are trusting Canada Post more with parcel delivery. And that's an important contribution to our livelihood, maybe during COVID, where we wanted things delivered to our house in a timely manner. But on top of that, they deliver a lot of other trusted letters and parcels and messages, and some of that trust rubs off on your message. So if you're looking for a message to come across in a channel that's trusted, and some of that magic trust dust falls onto your message, Canada Post is the place to do that. There's always some objections to mail too, and especially if you haven't used mail for a while. You're thinking to yourself, and here I am right now on a digital channel speaking to you, and I'm no Luddite who believes that mail is going to solve everyone's problems. We email about this, we are on social media about this campaign. All of our services offer tie-ins to online activities and signups whenever it's feasible and possible, because having a broad number of channels working on behalf of a campaign is the surest way to success. But people can still have objections because they think mail, well, that's got to be old school. It's got to be too expensive, and digital's just less expensive. And you know what? Young people don't use mail, so they why are we trying to use mail? Everyone's using their phones, etc. And you're right, they all are. But there are always limits to every channel and the activation that it can have. So you can send emails out and emails out and emails out. You send more and more. What happens eventually, the curve tapers off, and sending more emails doesn't get any more response. And then you can send SMS messages out, and then it tapers off. And then the next line might be radio, and the next one might be ads you take in local newspapers. But eventually, word of mouth, every one of them reaches its maximum. And you get to the point where what other channels? I've got still a group of the population that's not responding to all of this. What other channels do I have at my disposal? And those are the times when using a piece of direct mail or when, as I mentioned in the earlier slides, when it's important to be in people's homes, when it's a message that's about local participation, that's when you should be looking at mail as part of the overall marketing challenge. And some people say it's also very complicated. You need lists and you need time to plan and execute. And I'm going to try and address some of those issues coming up. You'll see in the coming slides, it's gotten easier and easier to do better work with direct mail. And one of the objections is that it's not as effective as digital marketing. But if you look at this slide, you will see that, and it comes from Canada Post, 5 reasons why direct mail works. There's a link to it on the bottom here if you download this slide deck later, because we will be offering this up on our website. You will see that Canada Post found that postcard marketing has the highest response rate. And I've seen this time and time again when people did studies. They would look at different channels and compare them. You can send an awful lot of emails out and try and get the same kind of conversion rate to people to take action and buy and sign up for things or come in to get a vaccine. And in this case, they said it's 10 to 30 times more effective. Well, when I did the math on this, I got like 36 times more, from 0.12% response rate up to 4.4. Now, every campaign is different. Depends on the offer you have, the time of day you're sending it, the time of week, but many, many tens of times more powerful per impression is what you get from mail. But importantly, if you've maximized your other channels and you still need results, then direct mail is a natural next step. You get new conversions that would not have been possible if you stuck with the channels that you're currently using because you've maximized them. You know, a lot of time this is called incremental new, say incremental new revenue or incremental new donors or incremental new vaccine participants. You'll get that by adding new channels that haven't reached out in the same way that the other channels that you've used. I'm going to switch now a little bit to the hows, whys, and wheres. We're going to talk about targeting because, you know, if you're a community healthcare professional, you're probably thinking about a geographic area around your hospital, around your health, community health unit or region. So I'm going to use some terminology in here, et cetera, that will help hopefully explain some of the opportunities for targeting. First of all, you could target a specific walk route. You know, not all postal walk routes are walked anymore, but there was a time when they all were, but they still use the terminology. Whether there's a community mailbox or whether there's a person walking the route, they divided Canada up into walk routes by and large, except for some rural areas. And the walk route usually has 500 or 600 homes on it. And so the postal system is kind of divided up into chunks of 500. You could be that specific, but in most cases, I'm thinking vaccine communications are more based upon like an area of a town or city, and in which case you're probably looking at something like an FSA. I did forget to mention the bullet point too, which is a walk route can sometimes just be an apartment. You know, there's just saying walk route number 23 is this apartment that has 100 units in it or 500 units. So you could target individual apartments, but generally people in the situation trying to say do a community campaign would be targeting something like an FSA. That's the first 3 letters of your postal code. It's often, you know, 5,000 to 20,000 homes and businesses. You also can target by some demographics. Canada Post has made it possible to overlay averages of home income, averages of age of people in those homes. But because, of course, you're doing it by walk route, it's going to be average of the 600 people in that walk route and average incomes of the 600 people. So it's a pretty general average, but it does allow you to do some targeting into areas in your community. For healthcare, probably things like targeting by the FSA, the first 3 letters is enough. You could go M4G. But then the final step is you can choose either homes or apartments or farms or businesses or all of any of those. So you could just say, hey, you know, our target audience doesn't really include farms, so we're going to stick with businesses, homes, and apartments or something like that. Those are typical kinds of selection cues. And I've just shown a picture here that's Toronto Island floating out in Lake Ontario, and you can see that each one of the little mapped out cubes or squares, little zones that's an FSA, M4P, M45M, etc. So you can get little parts of a community that are particular to an FSA and say, oh, that's where my hospital does its marketing, or that's our health unit, these 3 FSAs, and be pretty specific. And you can even carve parts of them out. Like I live in L4G, and maybe, you know, this side of the main street you want to target, but not the other side. You could do that once again by walk routes. And how do they make it possible to do this? Because you're thinking, how do I do all of this? Well, you can just select M5P. Like you could just say, hey, I want to mail to M5P. It's pretty straightforward. If you Google map, give me the FSA map for M5P, you'll find Google will provide you a little map of it. I just showed you a big composite map, but there are a couple of websites that show you those things. So you can kind of look at it right away and decide. The question is, well, how many people live in there? And I often tell people, like, take the population of your town. If you have 20,000 people in your town, there's about 2 people in every house. You probably have 10,000 homes. If you want a really rough budget idea. But, you know, the neighborhood mail service, which is most often used by people like real estate agents, local businesses like mechanics, you know, if somebody's having an open house, a dentist's office, all those things, they use neighborhood mail. And that's really like saying mail that comes as a unaddressed coupon or flyer, and tools that Canada Post has to make that possible, you could dial into something free called Precision Targeter. You can just Google that, or you can hit this link if you download the deck. You can contact Canada Post Data Services. Once again, the link is there, or you could Google it. Or you could contact somebody like a Canada Post expert partner. Prime Data is an expert partner, and there's a number of us like that who have skills to help you do some targeting across the country. And then you can say, work around your neighborhood, around your hospital or healthcare area, and define the area and the quantity. Here's a little map from segment from Precision Targeter, where you can see each colored set of streets is a walk route. So you can get a sense of, oh, you mean if I dialed into Precision Targeter and got a free account, I could select different walk routes around my town? It would. And then it would also give you a little chart like this, and it would show what's the quantity of houses, apartments, and farms in each of those walk routes. So after you pick, then you'd get quantities, then you can define your budget, and away you go. I'm going to tell you a few mailing best practices now. We're at about the 20-minute mark into this presentation, and I'm going to be wrapping up shortly, but I'm just going to whip through some of these things and then show you some examples of other people's direct mail that they've been using, and it might give you some ideas on where you could take your next steps. But remember, when your best practices should really include, figure out what your message is, target the audience, find the right timing for it, and then make sure you integrate properly with digital. I mean, bring people to a website where they can sign up for things, where they can regularly go and get updates about what's going on as far as your vaccination program and where they can participate and how they can participate. That's where you want to bring them in and bring them back regularly, ideally signing up for a push two-way communication. Seize opportunities for the course. Yeah, use QR codes, use mapping, expect about 4 weeks from the start to the in-home date. By the time you start this process, to find your target, design a postcard, print the postcard, and get it out to people's homes, it's going to be 4 or 5 weeks. Just remember that. Another way to deal with that is if you think you're going to do it over a longer period, take that 5 weeks, but print more postcards or flyers than you need, and then release the other ones later. And that way you could, like, say, stagger the audience. If you were afraid that too many people might come to your clinics right off the bat, or your call center might be overwhelmed, or whatever it was, stagger it, but print in advance so you don't have to worry about the lead time. Plus, you can usually get better printing prices by getting a lot of quantity done at the top. And here's a quick snapshot of what you're going to get for budget-wise. The postage rate these days for neighborhood mail published on the Canada Post website is 18.4 cents. That includes delivery to the post office for this kind of unaddressed flyer. And it usually costs between 5 and 10 cents for a postcard. So you're getting about $2,500 to $3,000 for each 10,000 pieces of mail. So, you can just quickly look at your neighborhood, figure out what the quantity is, and use that rough number to help you calculate. That will give you a very rough budget, but then of course the size of the postcard and the complexity of maybe the design and things might change that. If you go for very small quantities, it might be higher per unit cost than very large quantities, but then you just you can use that as a quick template and then get better prices from somebody that you're working with. Measuring results can be a little tricky because, of course, it's hard to separate out just the attribution that comes only from mail. And so don't expect that you'll be able to say to anybody, my mail program did this exactly. People mix the mail message in with all the other messages that you've sent, and they sometimes don't remember that it was the mail piece that sent them over the edge. But you will be able to see, if you've got QR codes and URLs, people landing on your page, if you have specific landing pages where only the mail directs to, then you can start to quantify the number of people that have been directed there. But that still doesn't mean that people who take other channels, like just walking into the clinic, etc., maybe saw the mail piece and it became part of the deciding factor. I said I'd show you some examples, and Alberta did more than a postcard. They did kind of a fold out, know the facts sheet, and quite elaborate. You don't have to be this elaborate. In my 5 to 10 cent budget range, would have probably been 5 times that to produce this little puppy. But the more panels you get, the more surface area of print, the more paper. Panels of print means cost, so that's why it would go up. But here's an example of somebody who did quite an elaborate one. You'll notice they didn't choose to do a QR code, which I find a bit of a weakness in this one, but you do be able to type in Alberta /vaccine, which isn't hard to do. Most people can spell it. And then you can get some information and maybe get a ride. Alberta also did a simpler version of a postcard. Once again, no QR code, but you can type fairly simply alberta.ca vaccine and get in there. I found other examples too when I just simply did a Google search for vaccination postcards. I found this one a little bit before COVID. BC was already sending out postcards reminding parents to immunize their children. So not completely invented this year or during COVID, that we should be using the mail to promote healthcare and vaccines. I found many examples from the States. There seems to be all kinds of stuff going on down there in different states and different healthcare units and hospitals and retirement communities, trying to remind people to book their vaccine clinics. So I showed you these just to give you some sense of them. I found them simply by Googling vaccine postcards, and that helped a lot to just find some samples and share with you. Here's some, wrapping up my last slide almost, where people also used it for things in the past, such as the HPV vaccine. Postcards were mailed out to communities in the States, saying, encouraging people to bring their kids in, or for HPV. The one on the left there, protect your daughter from cervical cancer. This was mailed out to parents of students at a university in Florida. And I think the idea behind that was that, you know, they could talk directly to parents, try and encourage them to get their kids to go to the university vaccine clinic and get signed up. And if ever there is a sign that postcards work, it would be this. I found this postcard at the bottom that came from Tennessee, and it was the Tennessee Health Department. And the article that was written up around it showed that Tennessee in July last year had decided to ban all promotion about vaccines. They became vaccine negative, shall we say. And if ever there's an indication that postcards work, they banned the use of them. So the article said that all Tennessee healthcare logos, etc., would be removed from all brochures, and they would stop any of their mailing campaigns to try and encourage people to get vaccines. Being banned from something, of course, always intrigues people, because you're like, there must have been some power in that message. And that's my sort of last takeaway. There's a lot of power can be delivered in a message, in a postcard. And here's an opportunity for healthcare workers to assess how they're communicating things these days and what channels they're using. And if they're maximizing what they're doing and they're looking for other incremental increases in the kinds of messages they're doing, then here's your opportunity. And if you've got other questions, feel free to reach out to me. Beth, did any questions come in? Are there a couple of questions I can answer at all during this session?
Yeah, Steve, actually, there was a couple of them. The first one is, how long does it take for Canada Post to deliver neighborhood mail normally?
Well, so the neighborhood mail pieces go into the local postal area, and then the postal carrier can only carry so much every day. So they sort of parse it out. So you know, you might show up with 20,000 in Aurora to be delivered, and they'll try to do those in 3 or 4 days. So depending on how far away the town is that you're delivering to, and then add on the 3 or 4 days it might take for Canada Post to deliver them once they arrive there. You could be looking at, if you produce mail in Ontario and tried to deliver it in Ontario, it would probably be in the neighborhood, in homes, in 5 to 7 days. If you're in BC, produced the mail in BC, delivered in BC, once again, about that 5 to 7 days. If you produced it centrally and tried to distribute it to farther parts in Canada, you probably have to add another 5 days to that.
Okay, perfect. Question 2, are there size limitations, or is there anything else I can do other than a postcard?
Oh yeah, so a Canada Post, I believe, so if you type in the words neighborhood mail guide or neighborhood mail specifications Canada Post, you'll find the exact specifications. I believe you can do about 6 inches by 12 inches for neighborhood mail before it goes into the oversized category and you pay an extra few cents for it. You can still mail a bigger piece, but you can also mail multi-pages, like the one in Alberta that was multi-pages that folded out. But to try, if you keep it between, you know, below 6 by 12, then I think you're going to find that that's the lower postage rate. You know, a lot of postcards used by real estate, local businesses, dentists and stuff, they're sort of in the 6x9 size. And that usually is enough size. You don't have so much information that you couldn't fit it on 6x9, I would think.
Okay, perfect. And the last question is, you didn't mention addressed mail. What if we wanted to contact people and have them come back for an additional treatment?
Oh, so yeah, if somebody's say signed up in your healthcare unit and you know that they've got a couple of vaccines and you're trying to get them back in. I noticed there were programs like that, yeah, for the flu shots and stuff, where they were keeping people's names. So you can switch to a different method, which is a personalized mail piece. And at that point, you could be mailing a postcard that's more like a reminder card you might get from your optometrist. You know, hi, it's been 1 year since you got your eyes checked, come on back in. So the card would be addressed and with a different marking on it. It wouldn't be like a flyer at that 18-cent price. You'd be paying about 50 cents in postage, but you could reach out through you know, a database. You'd send like an Excel spreadsheet. You know, anybody who is doing work with you would sign a non-disclosure agreement, take that data, use it for your mailing only, and then destroy it. You want to have certain assurances that there's good data practices on that front, because it is healthcare data. But then in the postcard, it would say, you know, come on back for your third shot, or it's time to come back for your second shot, or whatever the status is. You could mail those kinds of postcards. Slightly different service, addressed, different price range, but also very targeted and specific, as opposed to, say, covering a whole walk route neighborhood or an FSA. You're going right to the person's home who you want to deliver that message to. So you get a much, much higher activation, you know, conversion rate from those kinds of mailings.
Okay, Steve, we just had one more question come in. How sustainable is this type of marketing compared to digital?
That's a good question. You know, we've done some recent research, and I won't spend much time. If you go to Prime Data /sustainability, you'll find a study we did about the greenhouse gas emissions of a typical piece of mail that we work with. I hired a young researcher to do that work. We know from our commute to work, to our building and facility, and the paper and the print and Canada Post contribution, what the greenhouse gas emissions are. And we're trying to figure that out and find ways to use better papers that have lower greenhouse gas emissions, and give some selection and choices to our clients so they have options. Additionally, what we're offering is the ability to buy offset credits for the emissions that are related to it. The more interesting point is that just about every kind of communication offset has greenhouse gas emissions. And some of the work we're doing is researching the greenhouse gas emissions in the other channels. So if you had to activate through, say, social media and email tens of thousands of people, what would be the greenhouse gas emissions related to that for your cell phone, et cetera, et cetera? Because we don't want to see this as an option where you choose one or the other, because you don't have the full idea of what might be sustainable and what might not. All communications seem to have a fairly high impact of greenhouse gas emissions. Finding options and knowing you've got them is what we really try to provide these days.
Okay, great. Thank you.
All right. Well, listen, if people need more information, they can reach out to me here via email, at the email there. And I thank everyone for joining and participating in this webinar. Beth, thanks for moderating and helping me with the technical aspects of this. All the best until next time. Join me on LinkedIn if you want to have other information pushed into your LinkedIn feed about these kinds of issues. Thanks.